Knowing basic first aid can be the difference between a minor mishap and a serious medical situation. It's crucial to be prepared. Accidents and emergencies can happen anytime, anywhere. Understanding proper first aid techniques can help us respond effectively and potentially save lives. Many people make mistakes when dealing with common injuries. These mistakes can sometimes make the situation worse, leading to complications that could have been avoided with proper knowledge and care. For instance, never try to remove a foreign object stuck in the eye. This can cause severe damage to the delicate tissues of the eye. You could cause further damage. Instead, seek medical help immediately. A professional can safely remove the object and provide the necessary treatment to prevent infection or further injury. Similarly, applying ointment to wounds is not recommended. While it might seem like a good idea to keep the wound moist, it can actually do more harm than good. Ointment traps moisture, which can encourage bacterial growth. This can lead to infections that are harder to treat and can cause serious health issues. Clean the wound with water and soap. This helps to remove dirt and bacteria, reducing the risk of infection. Then cover it with a dry bandage. Keeping the wound dry helps it to heal faster and prevents bacteria from thriving. Another common mistake is using rubbing alcohol or vinegar to reduce fever. This is dangerous and can have serious consequences. These substances can be absorbed into the bloodstream, leading to potential toxicity and other health issues. They can also disrupt the body's natural cooling mechanisms, making it harder for the body to regulate its temperature. The best way to manage a fever is to keep the person cool and hydrated. This helps the body to naturally lower its temperature and recover more quickly. Consult a doctor if the fever persists. Persistent fever can be a sign of a more serious underlying condition that requires professional medical attention. When someone faints, many people try to lift them up. This is a common reaction, but it can actually be harmful. Lifting a fainted person can cause them to fall again or exacerbate any underlying issues. Instead, keep them lying flat and elevate their legs. This position helps blood flow back to the brain, which can aid in their recovery. Make sure their airway is clear and monitor their breathing. Elevating the legs improves blood flow to the brain, which is crucial for regaining consciousness. Always stay with the person until they are fully alert and seek medical advice if they do not recover quickly. Burns are often treated with home remedies like butter or sour cream. While these methods are popular, they are not effective and can actually be harmful. These substances can trap heat in the skin and worsen the burn. They also increase the risk of infection. It's important to avoid using any home remedies that haven't been medically approved. Instead, cool the burn under running water for at least 15 minutes. This helps to reduce pain and swelling. After cooling, cover the burn with a clean non-stick bandage and seek medical attention if necessary. One of the biggest mistakes people make with fractures is attempting to set a broken bone themselves. This can cause further injury and complications. Instead, immobilize the injured limb using a splint or any rigid object. Keep the limb as still as possible and seek immediate medical attention. Proper immobilization can prevent further damage and reduce pain. Section 4. Debunking more myths, sprains, poisoning, and drowning. In this section, we will explore common misconceptions and provide the correct first aid techniques for these emergencies. People often apply heat to sprains, believing it helps. This is a widespread myth that can actually do more harm than good. However, applying ice is the correct approach. Ice helps to constrict blood vessels, which reduces blood flow to the injured area. Ice reduces inflammation and swelling, which are the primary causes of pain and discomfort in a sprain. Heat can increase blood flow, making the injury worse. Increased blood flow can lead to more swelling and prolonged recovery time. In case of poisoning, the common advice is to induce vomiting. Many believe this will expel the poison from the body. This is not always safe. Inducing vomiting can cause the poison to re-enter the esophagus, causing more damage. Vomiting can cause further complications, such as choking or aspiration, where the vomit enters the lungs. Instead, call emergency services immediately. They can provide the best guidance on what to do next and ensure professional help is on the way. Drowning situations require careful handling. It's crucial to stay calm and act quickly. Never approach a drowning person from the front. They are likely to panic and may unintentionally harm you in their struggle. They might panic and pull you down. Approach from behind to avoid this risk and ensure a safer rescue. Grab them under the armpits or chin and pull them to safety. This technique helps you maintain control and ensures the person is brought to safety efficiently. Section 5. Final reminders, wounds, ice, and seeking help. Never try to remove an object embedded in a wound. This can lead to severe bleeding. Seek medical help immediately. When using ice on injuries, remember to wrap it in a cloth. Don't apply ice directly to the skin. Finally, remember that these are just basic first aid tips. Always seek professional medical help when needed.